Today I want to talk about a disease that affects 1 in every 2 men and 1 in every 3 women during their lifetimes. Now that I have your attention, please subscribe to the channel, like the video, share the video. Let's grow the channel together. I have noted that you people actually watch the channel, but most of you have not subscribed to the channel. So please do me that favor, subscribe to the channel. This is the Truth Podcast, and I'm your host, Siraji. The disease I want to talk about today is cancer. So what is this cancer? What is cancer? Let's find out. Cancer is a disease where abnormal cells divide uncontrollably and destroy the body tissue. Basically, the cells have lost, the ability to follow the normal control that the body exerts on them. Say they do whatever they want, they're out of control. It is divided into benign and malignant. In benign, the cells do not spread to other parts of the body. But in malignancy, the cells multiply rapidly. They affect the area and also travel to other parts of the body. They affect other organs. That is malignancy. So what are the types of cancer that we have? We have carcinomas, we have sarcomas, we have melanomas, we have lymphomas, and we have leukemia. Carcinoma, let's look at them one by one. Carcinoma. This is a type of cancer that starts in the epithelial tissue. These are the cells that line the inner and the outer surfaces of the body, like the skin, on the skin, and the organs, and the internal passageways. Carcinomas account for 80 to 90% of all cancer cases, so this is very common. So what are the types of this carcinoma? There is basal cell carcinoma, BCC. This is the most common type of skin cancer. It starts in the basal cells of the epidermis, the layers of the skin. Is the epidermis, the dermis, and the hypodermis. So it occurs in the basal cells of the epidermis. They're actually on the lower layer, the bottom layer of the epidermis. It usually grows slowly and doesn't spread to other parts of the body. The symptoms of this basal cell carcinoma include open sores, there's shiny bumps, and red patches. Another type of carcinoma is squamous cell carcinoma, SCC. Is the second commonest type of skin cancer. It starts in the squamous cells of the epidermis, the outer layer. It grows slowly. It does not spread. It affects the skin and the organs, that's the lungs and the cervix. Its symptoms include scaly patches, wart-like growth, horn-like growth. I think you have seen some people have, a protruding thing on their faces sometimes. That is this. So another carcinoma is adenocarcinoma. It starts in the granular cells that lines the organs. the lungs, the colon, and the breast. Typically develops in the mucous membranes of the glands or the organs. There is ductal carcinoma in situ, DCIS. This is the most common type of breast cancer. It starts in the breast milk ducts. It is divided into two. There is non-invasive, invasive breast cancer, which is confined to the milk ducts, and there is invasive duct carcinoma, which spreads to other tissues. Symptoms of this include lumps and discharge. So if you feel your breast, you will feel a lump, and sometimes there is discharge coming out. Another type of carcinoma is the renal cell carcinoma, renal. This is the most common type of kidney cancer. It starts in the tubules of the kidneys. The symptoms include blood in the urine or abdominal pain. Another type of carcinoma is transitional cell carcinoma. This one starts in the transitional cells, which make up tissues called transitional epithelium. It affects the bladder and the urinary tract. Another type of cancer is the sarcoma. Sarcoma is a rare type of cancer that originates in connective tissues, e.g., like the bones, in the muscles. When it occurs in the bones, we call it osteosarcoma. In the muscles, it affects the smooth muscles and the skeletal muscles. When it occurs in the smooth muscles, we call it leiomyosarcoma. When it occurs in the skeletal muscles, we call it rhabdomyosarcoma. This cancer can also start in the fat cells. When it does that, we call it liposarcoma. It also affects the blood vessels. When it affects the blood vessels, the cancer of the blood vessels, we call it angiosarcoma. Cancer that starts in the cartilage, affecting the cartilage, we call it chondrosarcoma. So this cancer develops from mesenchymal cells. These are type of stem cells that can differentiate into many different cell types found in the bone marrow and the adipose tissue. Adipose tissue is the fat, body fat, the fat in your body. We refer to it as adipose tissue. The types of sarcoma is bone sarcoma. Under bone sarcoma, we have osteosarcoma. This is the most common primary bone cancer. It's most common in children and in teens. It affects the long bones, that's the arm and the legs. There is under bone sarcoma, there is Ewing sarcoma. This is the aggressive type. It often occurs in the bones or the soft tissues of young people. Under bone sarcoma, we have chondrosarcoma. This one arises in the cartilage. It often occurs in old people. Then the other sarcoma is soft tissue sarcoma. Under soft tissue, we have liposarcoma. This develops in the fat cells. It's common in limbs and the trunk and the abdomen. It affects the fat, lipo. Under soft tissue sarcoma, another one we have is leiomyosarcoma, which affects the smooth muscles. An example of a place it affects is the uterus and the abdomen. Rhabdomyosarcoma is the aggressive type affecting the skeletal muscles. It's common in children. Kaposi sarcoma, that's another sarcoma and the soft tissue. This one is caused by human herpes virus 8, HHV8. It often occurs in immunosuppressed individuals. We have alveolar soft part sarcoma. This is a cancer that usually forms in the legs or the buttocks. It's still under soft tissue sarcoma. Another one under soft tissue sarcoma is dermatofibrosarcoma protuberans. It's a cancer that forms in the layers just beneath the skin, usually on the torso and the upper arm or the leg. Another type of cancer, we have melanoma. This is a highly aggressive type of skin cancer that develops in melanocytes. These are the sites that produce melanin, melanocytes from the word melanin. It can also occur in the eyes, the nails, and the mucous membranes. In the mouth, where the mucus is, or the intestines. Another type of cancer is lymphoma. This is a blood cancer that originates in the lymphatic system. The lymphatic system includes, the lymph nodes, the spleen, the thymus gland, and the bone marrow. It involves the abnormal growth of lymphocytes, the white blood cells. Types of lymphoma is Hodgkin's lymphoma. Under Hodgkin's, we have subtypes. Is classical Hodgkin's lymphoma. Under that classical Hodgkin's lymphoma, we have nodular sclerosis, mixed cellularity, lymphocyte rich, and lymphocyte depleted. And there is a nodular lymphocyte. There is an aggressive type of lymphoma too. This affects diffuse large B-cell lymphoma. An example, that is DLBCL, diffuse large B-cell lymphoma. And there is indolent, that is the less aggressive type too. Under that, we have follicular lymphoma, marginal zone lymphoma, which is linked to infections like H. pylori and hepatitis C, or autoimmune diseases. Another type of cancer is leukemia. This is cancer of the body. The body's blood forming tissues, includes the bone marrow and the lymphatic system. That's where it affects. It's a cancer of the body's blood forming tissues. So the types of leukemia that we have, it's divided into acute and chronic. So under acute, we have acute lymphoblastic lymphoma, ALL. It is common in children, but can also occur in adults. Progresses rapidly. It involves immature lymphocytes, lymphoblasts. Acute myeloid leukemia, that's another one. AML. This one affects both adults and children. It has a rapid onset It involves the myeloid cells. The granulocytes, they protect the body from infection, are affected. Examples of granulocytes is neutrophils. They protect us from bacterial infections. Eosinophils, they fight parasitic infections. We have basophils, which are involved in allergic reactions and contain histamine and heparin. And we also have mast cells. Those are the cells of granulocytes. Mast cells are present in tissues. They mediate host defense against pathogens and allergic reactions. The monocytes are also affected under acute myeloid leukemia. The monocytes are the largest white blood cells. They are produced in the bone marrow. The chronic type of leukemia, we said that we have the acute and the chronic. Another type of leukemia is the chronic lymphocytic leukemia, CLL. This is the most common in older people. It has slow progression. It involves mature abnormal lymphocytes. Another type of leukemia is chronic myeloid leukemia, CML. This one affects adults. It is associated with Philadelphia chromosome. That is a genetic abnormality. So today I wanted us to touch on this topic. In our next episode, we will go down exploring more about this topic. The diagnosis, talk about treatment and alternative methods. It's a drug I want to talk about. We will explore ivermectin. We will explore fenbendazole. These are two drugs that I am interested in. So with that said, please subscribe to the channel, like the video, share the video with your friends. Let's gain knowledge. That's my aim, just to educate people. That's what I feel I should be doing. With that said, see you in the next episode.